leadership is what we truly need to move the needle. And that's what CHOA has shown us. Leadership in identifying problems, leadership in partnership, and leadership in collaboration.
But our real goal is to keep kids from getting sick so that they're out playing, going to school, doing all the things that kids need to do and should be doing, not sitting in a hospital.
Our data really means something, and it's really connected to the kids in Georgia. And every bad outcome is a bad outcome for a real kid in a real family in a real community.
Kids don't really have a voice, and we feel it's important that children have a voice.
We've had CHOA board members down here talking to the House, talking to the Senate, and they walk in with certain credibility to begin with.
I think it goes back to the merger of Eggleston and Scottish Rite when the boards came together and they agreed on 3 guiding principles: that children are better cared for in a children's hospital because the outcomes prove it, that these assets belong to the community, not them, and that it was their obligation as fiduciaries to ensure that specialized pediatric care is in this community for generations to come.
Every single child health indicator for Georgia's children, we're in the bottom 10. And if we're really looking for the future of Georgia and how do we bring business and how do we expand our economy, that's going to start with our kids today.
We're looking at potentially losing a generation because of childhood obesity.
Children's Health Care has given the PE teachers in the state of Georgia a charge that show these children how to be fit and how to stay fit and have fun doing it.
We're going to be taking care of these kids one way or another. If we can spend a dime and save $10,000, we've helped our budget as well.
Hugh Spalding treats about 70,000 kids a year, and 96% of the kids at Hugh Spalding are indigent or charity. Our board made a bold commitment to take on the obligation of Hugh Spalding, and we're so grateful for that. But it was really all about the mission. It was about there's 70,000 kids that need us. They deserve the same level of quality of health care that's provided at Eggleston and Scottish Rite. And we are so proud that we've been able to do that.
The vision that CHOA has is wonderful, looking at healthcare needs and helping these children and babies to grow up and be healthy. And I think it's a huge asset for the state of Georgia, which I don't think most people in the state really have an understanding of unless their child has been there at some point in time.
My wife and I were foster parents for 16 years. So we've been to the Atlanta's healthcare system several times with kids that were abused, and we had to pick them up there. And being one person, you can't advocate, but being a community, we can advocate, and these children are going to grow.
Anybody can make a difference. Any single individual can make a difference, whether it's one child at a time or whether it's hundreds of children or it's thousands of children.